and welcome to Workforce Wisdom. I'm your host, Christy Bray, Chief Strategy Officer at PracticeLink. This podcast focuses on the latest trends in healthcare recruitment while showcasing innovative strategies, success stories, and fresh perspectives affecting the healthcare workforce. These episodes lead to in-depth, thoughtful discussions with recognized industry-leading healthcare professionals, exploring the challenges of healthcare recruitment and beyond. Whether you're an experienced recruitment professional or just starting out, this podcast aims to help you discover how experts are reshaping the industry, leveraging technology, and fostering inclusive hiring practices. Today's episode of Workforce Wisdom, Healthcare Leadership, Innovation, and Evolution with Tom Farrington. Welcome, Tom.
Hey, hello. Thank you for having me today.
Thanks so much for joining me. For our listeners, Tom is the owner and president of Tom Farrington Consultancy and a retired physician recruitment leader. He is certified and has served as faculty for the CPRP certification course with AAPPR. Tom is passionate about effectiveness in communication and building strong partnerships. So that's a very short intro for someone with such a long career in healthcare. I'll let you say the number if you want to put the years on it, but it's several decades. Tell us a little bit about your journey and then maybe some of the pivotal moments that shaped your path.
Sure, thank you. So as I think about it, I've had about 45 years in healthcare, give or take a year or two. And that does include me starting in healthcare in the local hospital when I was in high school. And the truth is, I never really left. So kind of a fun story. As you know, most of us in physician recruitment didn't really have a clear path to get here. Sometimes they were clinical paths or sometimes marketing or HR kind of paths. So again, in high school, I worked at the local hospital and I worked in the kitchen and eventually then in the diet office. And I stayed in those roles kind of part-time off and on, even through college. So when I finished college in the 80s, I had a degree in food service management. And I wasn't real sure exactly what I was going to do. So I went back to the hospital for the summer. A kitchen supervisor job opened up shortly in the late summer after I had returned. And I kind of wanted to go into that role. And it was a fun leadership role for me to start my leadership career. Because for 6 years, I'd worked with a lot of these folks kind of side by side, right? And so it was going from a peer up into a leadership role. So when I was in business school in the 80s, they were teaching, it's a Deming principle and it's total quality management, right? And what that talks to us about is letting the people closest to the work help make process improvement. And the organization I was working for was just embracing this like Ford and Toyota and a lot of big organizations were. So I would sit down with these ladies who made up the patient trays and I say, how are we going to get the trays more accurate? How are we going to get the juice on there that's supposed to be or whatever? And at first they'd say, Tom, you're the boss, you tell us. And I said, no, it doesn't go that way. We're going to do it together. And so we did. And they're like, well, if we move the cooler with the orange juice over, because it's our most popular juice, it would be right there and I wouldn't have to turn and reach. Oh, so making simple successes through that process really helped me root myself in leadership. So most of the things I've done through my career were leadership types of roles. I was the hospital dietary services manager. I left that role for a role with the hospital foundation and hospital marketing department. When I went into that was not a leadership role initially, right? So I made the transition and was an individual contributor, but I studied the field and I learned the field and did go to have a leadership role. I was a marketing manager at one point. So that was good. And then there was a time where I had an opportunity to come into physician recruitment. Again, I came in as a recruiter level, but then after several years, had the opportunity to go into leadership. And so I think if you're going to be a leader in a field, you need to learn to be a leader, to be an effective leader. And so I had to learn how to do sourcing and I had to learn how to manage site visits and candidates and have crucial conversations, et cetera.
Yeah, I think a lot of people will call it, learning to work the desk, whatever desk that might be. In your case, it was the trays in the cafeteria, but you do have to go back to the very, very basic of what you're trying to accomplish. So you mentioned the Deming principle, which I'm familiar with. As you've transitioned, any other key moments or previous experience that has influenced your approach to leadership? Do you have a book that you would recommend to the audience?
Well, so I'm a big fan of Stephen Covey. So Stephen Covey's brought us the 7 Habits. And I read this in business school in the 80s. And I think as a young leader, you come out and you're going to apply all these principles, sort of. But through life experiences, you really do begin to fall back and use these tools. But one of the things I remember, and I always kind of pointed to and tried to remind staff, particularly professional staff when I was in marketing and physician recruiting, was about the quadrants. And so Stephen Covey brings us the 4 quadrants, right? And the listeners can easily research this through an internet search. So quadrant 1 are urgent things that are immediate and need attention. What you really want to spend, I think, as a leader or as a professional, a lot of time in quadrant 2, and that's relationship development and strategic planning and trying to get there. And so I think you have to be intentional about that. And sometimes it's hard. And then you get that call, or the CEO wants a report, or the CFO wants you to come over to the boardroom, or what have you, that you really have to kind of preserve that time. And so making that time and recognizing what is landing on your desk, and is it something you have to do? Is it something you can delegate? And so there's that opportunity as well too. And again, that's not a clean understanding from the beginning. You have to kind of learn that through life experience and probably have to get burned a few times.
Yeah, the time management skills, I think there are lots of principles or books on that as well, but spending your time on the most value-based opportunities for you and your career and then your organization of what they require. One of the things I always found, candidate sourcing is so hard. It takes a lot of time. It isn't like an instant gratification piece. Is that something, when you would structure your day as a new recruiter, how would you do that? I don't think you probably had a sourcing team back then. More common now, but how would you structure your day or your week as a new recruiter?
One of the first learning assignments, I guess, that I had in physician recruitment was they gave me 4 general surgery searches. And they were all a little different. Some were rural, some were suburban, that kind of thing. And we used databases back then. Maybe today we would say they are archaic. And I found that in order to be effective, I needed to call surgeons late in the day. So I needed to structure my day where I was going to be able to make calls from 4 to 7. And I think like this job, everything is a balance, right? And so you don't want to start your day at 7 and end your day at 7, 2 or 3 days in a row. You just get into a burnout scenario. So kind of thinking and being intentional about how you structured that and how you put that time in that block. And every discipline maybe is a little bit different. Surgical specialties, they're busy early morning through mid-afternoon, right? Family medicine and pediatricians are often available around the lunch hour. I don't think anybody gave me this list, hey, this is how to be successful at this. But again, you just kind of learned. And believe it or not, many years ago, we used to actually buy a Yellow Pages from a different market. So I'm in Indiana, we might buy the Champaign, Illinois Yellow Pages and look up OBGYNs and try to make calls and get through their gatekeepers, their front office, in order to leave just a message and say, this is a personal matter. I need to talk to Dr. Smith, that kind of thing. So sourcing, I think, has changed immensely through the years.
Yeah, it has. And I think it's interesting you referred to using the phone book or a database. Those methods still apply. I think a cool thing with technology is, at least from an email or a text capability, you can set those for those preferred times. I know I've had teams that did many of the same exercise, if it was a Wednesday, a Thursday, or a Friday. And some of the technologies we have will tell you by specialty who opens, who reads at what time. And so you can easily just delay send or whatever now, a little bit easier in your daily schedule. As you've kind of grown into that recruitment and then maintained some of those leadership skills, are there any other technology advances or things during your tenure? Because you started out with Yellow Pages, probably a fax machine, maybe the call tree.
Yes, cold call. Right.
And then moving into today with what I said, from a text capability, all of the things that we use now, what's kind of been a key milestone maybe along the way or something within tech that was super useful?
Sure. So I think at some point with the email tools, we made a shift and we're able to tell when people opened our email or when they had opened it twice or 3 times, or if they had forwarded it, right? And so to me, that was a real helpful tool. So I would say to my staff, we're not going to have to do cold calls, you guys. And they all be like, oh, that's great. But we're going to do warm calls. And they're like, well, wait a minute, what are warm calls? And I said, so a warm call is when you know that somebody has been interested. And so we're I guess that's maybe the early part of what AI is, but we're able to look in and we're able to see, and we can run a report, and certainly all the tools and PracticeLink does this. So we can get a glimpse in there, and it helps us kind of then focus, because, time is a commodity and it's limited. And so the broad side of the barn, if you're going to try and call 100 people, but if you know that there's 8, that's worth your time, right? And so to me, that was a big improvement, because remember, again, I was the young recruiter using the yellow pages trying to find general surgeons. I had a mentor, and she said, you're going to get a lot of no's before you get your yes. And you're right. It's not an instant gratification thing. Now we're in this day of AI, and I don't even think we know enough about AI. And I've heard even on one of your podcasts that you should be cautious not to train AI to have a bias. And I think AI can be tricky. And so you really do need to understand how to use the tools that are there. I think as a recruiter or recruitment leader, you probably need to be partnering with somebody who has a line of sight into this in terms of AI. I don't think you should just go out and use ChatGPT and start coming up with recruitment strategies. I think you have to be thoughtful. A lot of healthcare organizations, I do believe, are risk adverse. And so they're wanting you also to be very careful in terms of how you're approaching and using AI. And so I think in many ways, we're fortunate to live in this advanced technology. In a few ways, there are some things that give me pause. And I feel like we should be cautious in terms of what we're doing and how we're doing it. And I'm a big proponent, I don't know if I said this earlier, but in this industry, we need to network, right? And so I need to know somebody who maybe has some of the same challenges, not in my backyard, but in a different market, who I can call and I can say, hey, how have you approached this in the past? And I think that AI is a perfect example of where we can do some idea sharing across the industry and talking to somebody in a different market and saying, have you tried this, or what have you done that was successful, or how did you get the attention of a rheumatologist, or boy, I'm having a really tough time connecting with urologists. Have any ideas, that kind of thing. One of the gifts I think that physician recruitment provides us is the people are inherently interested in networking and sharing ideas.
I think we both found ourselves as AAPPR members and went through certification and became leaders within that organization on different committees. And I credit that for where I am today. Honestly, it's a great association. And you find just really open people willing to share documents, share PowerPoint presentations, get on the phone with you. I do a ton of phone calls with people because we all get better together. And so I really think the members really embrace that. So it's awesome to see.
I came from hospital marketing where you would never, ever share. That just was not at all acceptable. You wouldn't talk to your competitor. You might see them at a United Way breakfast and nod heads, but it was a shift for me to make that adjustment. But one, I'm glad to, and like yourself, it kind of ties to who our personality and who we are, right? And so we do all want to rise together.
When you were talking about AI and some of that balance of how you integrate new tech and things, I would caution some of our listeners, just be aware that AI is a data collection machine. It is aggregating all of this data on all of us all the time, just like your Amazon search. There's a reason when you search on Amazon and these things start popping up, in your other feeds, your social media feeds. Be cautious about that. If you're uploading your organization's strategic plan into ChatGPT to ask it questions about, it's now living somewhere unless you have purchased an account or you read the fine print on what the protections are, because you feed it data and it is easily extracting that. And I don't know that we have a solid hold on where it's going after that.
To AI, they're making some remarkable improvements or utilization of AI in patient care, right? And so a lot more study and focus around that than there is around physician recruitment, honestly, right? And so patient care is very high stakes, and so is physician recruitment. But there's a lot more, I guess, clinical oversight and informaticists who are watching that type of thing, as opposed to artwork.
Did you know PracticeLink, the nation's most trusted physician recruitment resource, now offers PracticeLink Pro Marketing? PracticeLink Pro Marketing is a brand new, powerful recruitment sourcing solution built just for healthcare organizations. With custom strategies, targeted reach, and data-driven results, PracticeLink Pro Marketing helps you attract top-tier candidates and fill hard-to-reach roles faster. Ready to elevate your recruitment game? Visit PracticeLink.com and schedule your free consultation today.
So during your 45 years, and you said previously you've covered both rural markets and then there within a city, any significant healthcare policy changes that you've seen, and how have those affected some of the hospital operations? And again, back to the patient care that you mentioned.
Sure. So, I mean, I remember back at a time young in my career when they first rolled out DRGs, right? And so that changed how Medicare and Medicaid were basically reimbursing hospitals and health systems for services. And that did cause, I mean, they kind of look back in the good old days before that, where maybe in the kitchen they had 8 people who would wrap silverware, and now they only had 2, right? Just because they had to make those adjustments. But I think maybe a constant that I've seen, so technology's changed. We in particular are seeing a different generation of physicians, new physicians coming out, right? And so physicians who are baby boomers are retiring rapidly. On the flip side, many of us who are baby boomers are seeking, I guess, a higher level of care, right? We need more access. So I think all of that kind of moving together then with this younger generation of physicians who maybe often are having more boundaries on their work or their roles. I don't know, that's so much policy per se. I think the thing, though, that is a constant that I've seen really, I guess, through my whole career in healthcare from many perspectives is the pressure on reimbursement. So it's getting tougher and tougher for hospitals and medical practices to deliver care, maybe in the traditional sense, more challenges, more prior authorizations, more pre-certs on procedures or tests, those kinds of things. So that's something that the business side of medicine has really become forefront at the table in terms of the care plan. And so how to effectively navigate that and manage that is, I don't know that there's a clear answer.
Yeah, and I think the way you described the business of medicine, I know early in my career, and I started in high school in healthcare, just like you did. I was an athletic trainer in high school and in college, but didn't realize it was a business until I switched over probably to more of the administrative and operator roles, where as a clinician, usually you're not involved in the business of the day-to-day, but these are gigantic businesses with some folks. I'm here in Nashville. These companies are employing 250,000 people. That's a very, very large number. And then they're caring for millions of lives across the country. So the numbers get really big really quickly because healthcare is something that touches everyone in their lifespan. Let's talk a little bit about some of your workforce development and training. As you've worked with staff, and I'm sure you've brought in new folks and been able to provide them training and education, and they've gone on to do fantastic things. But tell us a little bit about how you approached workforce development and training to ensure your team was able to adapt. We've mentioned healthcare is forever changing, but how did you provide that to them?
Well, so I think part of this goes back to perhaps how you're interviewing and screening candidates to work in physician recruitment or in recruitment in general. And I probably didn't always do that with success, especially early in my leadership years there. Because as you know, we're developing more and more tools in terms of training physician recruiters and formalizing the education. But back years ago, we didn't have so much of that. And so we do a lot of on-the-job training regardless in this. And so we need people who are flexible and results-oriented, and it's a little bit of sales and a little bit of marketing and being able to take notes. So in terms of selecting staff, those are some tips. Any leadership or even non-leadership role, you have to listen and you have to have conversations. You have to listen and understand what is on someone's plate or maybe what's in their head at times. And you have to listen for those things and you have to look for those things. So you're having dialogue. And then from there, you can maybe come up with a plan and help them, coach them to success or get them the resources that they need. Or maybe they need a little brushing up on how to have a crucial conversation with the group of general surgeons who are interviewing a candidate and they go off the track. And so sometimes I would just go sit on an interview. If I knew it was going to be a tough interview, I would join the recruiter, maybe with the orthopedic surgeons, maybe sometimes say, now, what's your wife going to do? She can have more kids. And then I'm like, Dr. Smith, you can't ask that. And the recruiter would say to me later, well, gosh, I would have a really hard time saying that. And I said, practice it. It gets easier, but your job is to help protect the organization, right? And so you have to make those calls. So kind of coaching and mentoring people in the real space at times was an effective tool. So I had a distributed team in my last role. They were like from Indianapolis to Chicago. And so that's a big geographic area. But you have to bring them together 2 to 3 times a year in person when you bring them together, you have to structure it. So there's some professional development. Everybody's getting some learning. There's maybe some workflow process kind of things, but you have to have a little fun, right? Because the fun will carry you through the hard times. So if your team has a good relationship and they have fun with each other, then they can pick up the phone, they can call each other and say, hey, how can we get more family medicine doctors in our pipeline, right? And so you have to kind of foster that. And that's a little different than a discipline like, say, accounting. We're working with the humanities in our field, if that makes sense. And so the main part of that is the human part.
Yeah, I agree 100%. I think one of the things you said in that was the ability to accept being told no. Did you have a day where you were broken up with by a candidate? More than one. My record is three in one day turned down job offers. I hope that's not everybody's experience, but it was a really rough day for me. Just being told no is really tough.
Part of the being told no by a candidate about an opportunity in the beginning, I let that personally devastate me. I feel like I learned to listen to that. And again, if you as a recruiter had a great relationship with a candidate, then you're on footing to start to ask some questions. So what you have to do is help manage that back into the organization, and you have to maybe share that, because I think it's worse on a practice manager or a lead physician in a group to hear the no than for us, because we're not terribly unaccustomed to hearing the no. You have to take that back to the practice and to the leadership, and you have to say, here's what Dr. Smith said. Here's what Dr. Gupta said. How are we going to resolve this issue around the undefined call? How are we going to resolve this issue about having to go to the outreach facility to deliver babies on a Tuesday? Whatever those things are, your role as a recruiter is to take that, they told me no, but you have to leverage that so you can be successful. The practice can be successful in recruiting the next time out of the gate.
Yeah, I really hope nobody has my scenario, but it depends on your book of business of what you have, and they have even more opportunities. My general statement about it is physicians and healthcare providers can pretty much throw a dart at a map, name their price, name a lot of things, and have a job. And so, you need to be aware of what your competition is doing, and your competition really is the whole country. You can't just think of it, I know they want to live in this town. Maybe. Physicians and practitioners are just super mobile these days, and way more than we've ever seen out of that workforce.
Sure. So I would say, like, during the pandemic years, as we were monitoring turnover, we absolutely saw it increase. And why? I mean, you make some inferences. People want to be closer to their parents. They felt like they needed to, nest a little bit more where they're from, those kinds of things. And so I think that's a factor, and that's the reality. Interesting trend that I saw the last several years was, so maybe there are physicians who are grandparents maybe coming to a market because their kids are here. And so that was a thing I had never seen before, maybe so much in my career. But now the grandparents are following the kids, and they're uprooting their many years of professional practice to maybe come and be in a different market because their kids had settled there, that kind of thing. So,
yeah, I think sometimes you'll see some advanced retirement planning by physicians. Florida, California probably benefit from that. They're looking to be beach style or, different lifestyle where they're doing more of that in advance just to prep for those retirement days too. Tell us a little bit about your team's involvement in the onboarding, which leads to retention of those providers, or did you have a set committee or structure within your last organization?
Well, the last organization, I think I was there maybe 12 years, and I had been there a year and a half or two, and I was observing the onboarding, and honestly, it was not going well. And I thought, this is not centralized. There's not a focus. It's not candidate-centric kind of thing. So, of course, I made some noise, and then I was honored with owning the onboarding process. But better maybe to have it than to not. And then if you're going to have it, take it and do it right. And then from there, develop a robust program that's intentional. And we had physician recruiters checking in with new hires 6 months into their practice. We had a practice executive checking in at 9 months. We had a medical director checking in the first quarter, that kind of thing. So if there are things that are wrong, like they're not getting their labs or little things that could really be a very big dissatisfier for particularly a young new physician into practice, he or she could see some resolution to that, right? And not start Because we all know that if a candidate has a bad day or the third bad day in a row, then they're a little bit more open to those people soliciting them about other opportunities. And so you want to try to get that sooner rather than later.
Yeah. If you're having conversation with CFOs or other folks, these are soft costs. What becomes a hard cost is when there isn't a provider. So I've always found those lost revenue calculators and then the expense on, okay, we are going to keep it open and we're bringing in a locums, and then your reputation in the community. And so all of that, the hard cost is really in the lost revenue or a higher price tag on who you bring in. But the rest of it, it's hard to quantify that for folks. Some leaders will easily say, well, they're not producing enough. They're not making their RVUs, those types of things. Just go find somebody new. Well, we're way past the day of finding someone new to slot in there. And so it's better to work on that retention side, help them. What do they need? Do they need a scribe? Are they struggling with the EMR? Maybe they really, really want to be a 0.6 FTE. That still fills a gap in your clinic and your OR.
And you have to be vested in them. And you're right, the CFOs are the toughest maybe to understand that. But you really do have to give them the tools they need in their practice. And so maybe business development needs to take the surgeon around and round a little bit with the primary care docs. The connections they make are amazing, right? And I've done that. Put a doctor in the car and take them around and introduce them to their referral sources, or go to physician networking events or docs to docs or provider to provider events, those kinds of things. So helping them, sometimes it's how do they set their schedule, right? And so they just have 2 quick acute visits right before lunch, or they only do 1 new patient mid-morning and 1 new patient mid-afternoon. And a good seasoned practice manager can really help a physician do that and tweak that so they're getting to effectiveness, or blocking 20 minutes mid-morning for charting, et cetera, right? I'm no practice management expert, but what are all those things that go into that bailiwick that are making them successful rather than, hey, they're not working out, go get a new doctor? I agree with you. That's a tough call.
It is a very tough call. One of my early jobs was a scheduler for a really busy cardiology clinic. It was fascinating work because you're just solutioning all the time and trying to get people seen. And we'd have physicians who could see 60 patients in a day. They'd start at 7 a.m. Their patients were the most satisfied with his care. And then we have guys that we knew 30 was their cap. So you have to work within that and figure out what works for them. You mentioned that this is a human person that we're working with, and that's key to what we're asking these providers to do.
So, another tool that we used a lot was predictive index. And so predictive index, it's a simple, maybe you fill out 60 different bubbles on a form, but then it kind of tells you who you are. It's a mini, not a Myers-Briggs or anything like that, but it's just kind of tells you who you are. But using that and getting physicians to do that so you can match an MA with them was amazing, because sometimes you would just bring a doctor in and, Susie was an MA here with Dr. Smith for years. And so Susie had her own mind about how things should go, right? So, using tools like that, again, I'm a big proponent of having a toolbox, but using tools like predictive index and other tools to kind of help physicians get people around them who are going to help them be successful. They're like snowflakes. Everybody's a little different, right? And so helping kind of unpack that and set that up for success.
Agreed. I think for the recruiters listening, the key there is really getting to know the practice as well, so that you have those pieces. So the best calls I had as a recruiter were with the practice manager and maybe the lead physician or something like that, just to really get their day in the life. So you could tell that story to candidates. And oftentimes I had primary care. We had multiple clinics they could work in. And when you get to know that candidate, you can say, this location would work better for them. This probably won't work out. And so it's imperative that you spend the time getting to know the operators within the medical group or the hospital so that you have that information.
So I think as a recruiter, sometimes you see the match before the candidate sees it. And the tough thing is to sit on your hands and let it play out. So 9 times out of 10, I feel like I was right, or I called it right. Every once in a while, there's somebody like, I have to be in this particular suburb. And you're thinking, oh gosh, I just don't see them meshing. But that's more important to that candidate. But otherwise, I say, as a resident, I'd say, can you take a day off from residency and spend the morning at practice A and the afternoon at practice B? And once you're there for more than an hour, they're going to kind of forget you're there, and you're going to see the real workflow of the practice. Where if you just go for lunch or you just go for 15 minutes, I think everybody's on their game. What you want to do is you want to kind of see how that lands a little bit deeper into the day. And then that gives you perspective. And again, that's where sometimes I had candidates come back and say, oh gosh, I want to go to practice B. And I was like, it was obvious to me all along. But you have to let everybody else around you see the match on their own time frame.
Yep. All right, we're going to focus on a tough question here, but I'd like to hear about some of the challenges that you had in your career, either within your team or, professionally over the decades, and what strategies you used to navigate through that.
So we're in high stakes work, and I think some of the challenges have always been, if you're not telling people, C-suite, recruitment committees, others who are stakeholders in your work, if you're not telling them what you're doing, maybe they're assuming you're not doing anything. That's human nature to some extent. Maybe that's not very forgiving. So I think earlier in my recruiting career, getting caught off guard was something that was a challenge for me and not kind of understanding. And so you almost have to stay ahead of the stakeholders in terms of reporting and managing up and giving information and telling them not only about the no's of the site visits, but telling them about the no's of the people you had the phone calls with. And so to me, that was a challenge. As a leader, there's always challenges between what is coming down from upper management and how are you helping your staff sensate that information. What does this mean? Because healthcare is rabid with change and people don't like change. And even as much as you think of the profile of a physician recruiter, they don't like change either if they're not in on it from the beginning or helping control it, right? And so helping people understand and manage through change. Reorganization. I've been in healthcare a long time, so I've seen a lot of reorganizations. That's very difficult when you have to apply that within your own team. And so having sensitivity, I think, around that and just helping people understand and coaching people through that.
Those are great tools, both for somebody who might be just starting out and then folks who have found their way into those leadership roles. We talked earlier about the power of networking. So go a little bit further on mentorship. I'm presuming you've been a mentor and a mentee to a lot of folks over your career, but any advice for those emerging healthcare professionals?
So within physician recruitment, and if you're at a smaller organization, there may not be that mentorship down the hall. And so seeking that out through AAPPR has a program to hook up mentees and mentors. But I think about some of the mentors I've had in my career. At one point when I was in marketing, my office was next door to one of the hospital administrators. He didn't know much about marketing and I didn't know a whole lot about running a hospital. But Randy and I talked a lot, like after 5. And so I learned a lot from him just in terms of my leadership and honing my values, et cetera. So don't always think the mentor has to be in a box. There are people who have worked outside of my organizations, but are close to healthcare, but in a different role, who have been great mentors to me. I've tried to pay it forward, right? And I've tried to give it back. Or if there's a new recruiter in town, maybe at St. Elsewhere, to give my business card and say, hey, feel free to call me if you have any questions or that kind of thing. Not to infringe, but really just to help them be successful. And I think that our field is very much about that. And meeting people at conferences and going to often the first time attendee receptions and kind of help through committee work, whatnot, and kind of helping just comfort people and just being a voice and somebody to check in with, that kind of thing. So yeah, I was fortunate to be able to be faculty for some of the CPRP certification courses with AAPPR. And yeah, usually you have a triad, maybe there's 3 of us doing the 2-day session. My style would not be to stand and lecture to the group the whole time. It's let's start to talk, because again, as adult learners, I think we learn better from each other. I would come out of those sessions with energy and having learned from the recruiters who were attending.
We've consistently said, the rising tides lifts all boats. I think is that maybe that's the theme of today's podcast, but I fully agree with what you've said there. So, okay, I want to ask you to get out your crystal ball, make some predictions for us for healthcare, how we as professionals can prepare for upcoming challenges and opportunities. It's totally okay if you want to talk about workforce shortage. We'll just put that one probably at the top of the list. But what other predictions do you have for us?
And to the shortages, I think that we're in a position to really be advocates for the changing role, in particular, of the APPs, advanced practice providers. These are physician assistants, nurse practitioners, CRNAs, et cetera. So maybe a rural hospital has very limited bylaws, and sometimes those providers can't even round in the hospital, those kinds of things. So I think through some of our advocacy, if you read any of the studies, we're clearly going to have to make some adjustments in how we deliver care. And so through our continued advocacy in partnership with medical directors and C-suite folks, making that advocacy, I think, is important. I think it's moving fast. I think we do see a lot of physician recruitment folks who are maybe retiring early. And so there's a new, younger breed. And so kind of helping them be successful and helping them hone their tools. And what worked then sometimes works now. I think to be successful in physician or provider recruitment, you have to use a multifaceted approach. You can't just post and pray. You can't just put a job up there and wait for candidates to come in, right? You've got to be proactive and active in terms of managing the search and having relationships and calling the candidate that got away last year for whatever reason and just reintroducing the opportunity. And so being innovative and trying to be successful. I think the changes in terms of technology will continue to come down the pike. My approach to that is to ask others what works or what didn't work or why it worked or maybe why it didn't work, those kinds of things. And really just use your networks to understand that, because we're in a fairly unique role. So hospital marketing maybe doesn't understand our challenges. HR recruitment often always doesn't understand our challenges. And so who do you have left? And our industry partners, right? And so our vendors, PracticeLink and the other large companies are often a good resource for us as well too.
Yeah, I think some of the best partnerships that I have even today came from the vendor side. And I was raising my hand at one point, the largest hospital coverage me and my team provided was for 89 hospitals across the country. It was a large health system. And I knew that our vendor partners served the whole country, so their client panels are even larger. If you have a chance to go work internationally, you get even a different experience. And I very much intentionally cultivated those relationships with those partners because I knew they saw the whole country. Maybe I was in one or two states, but they saw the whole country and they could see those trends and kind of alert you. And I agree, those are great partnerships to make. Well, we're going to wrap up with one question here. So Tom, you've retired, you've started your consultant agency, and we wish you luck in that. What do you hope your legacy will be in the industry? And then how do you measure the impact you've had over the years?
Well, thank you. It's kind of an honor to be asked that. I hope in terms of my legacy, and not every day was a picnic, right? But I hope that people feel like I was impactful. Most of my jobs have always had a role of collaboration, whether it was marketing or bringing people together, collaborating. And so I hope that collaboration kind of comes to mind. I do pride myself on having been a successful leader. I'm okay now for the last year not having to be a leader, right? It's sleep well, that kind of thing. I think in my prime, I was hopefully a successful leader, and I think 9 out of 10 folks would recognize that. My wish is to help pay it forward and to support the industry. The people that work in physician recruitment are special kind of folk. And so I want to continue to be here for them. And I have a lot of calls. I have a call in a few minutes with somebody, just kind of networking and checking in and exploring what future partnerships look like.
Well, I think a 9 out of 10 is an excellent top box score for all those hospital people watching Top Box. So I think you've done well, my friend. I appreciated our connections over the years and look forward to seeing what you get up to.
I'm grateful for the opportunity to visit today.
On behalf of myself and PracticeLink, wanted to thank Tom again for appearing on the Workforce Wisdom podcast. For our listeners, please feel free to reach out with any thoughts, insights, or questions about anything we covered today. You can email plmedia@practicelink.com. My name is Christy Bray. Thank you for listening.